Yes, Myanmar is the only country in Southeast Asia where hepatology is a separate subject. You look Thailand, Malaysia, Singapore, all the countries, they have a gastroenterology. We don't do the endoscopy, we're too busy. I mean, we have a lot of things to do in our hand. So, first of all, I would like to thank Professor Dumo, and again, I am Malay, because they've been planning for this trip and for this meeting, French-Myanmar meeting, for the last 3 years. Now, the dream comes true. And I have to thank the organizing committee also for bringing us here to Bordeaux. And before I talk, I would like to say about Myanmar. Where is Myanmar? Myanmar is between India, Western Bangladesh, Eastern border, China and Thailand. This is Myanmar. You need to know two things when you come to Myanmar. One is Shwedagon Pagoda. This is solid, covered by solid golden plates, this thick, and Aung San Suu Kyi. We've been under the generals for more than 60 years, and she liberated our country. HIV is a global problem, and I must congratulate Professor Peron for excellent presentation. Today, I will be talking a different type of hepatitis E, entirely different from your part of the world. Around 1976 or 80, we are not sure of what kind of hepatitis. It is enterically transmitted hepatitis or transmitted hepatitis, not very clear. Then a Russian scientist swallowed the stool of 10 patients. This is Dr. Balayan, director of the Institute of Polio and Viruses in Moscow. He went to Kyrgyzstan to collect the outbreak, collect the stool, and proper nitrogen to carry back to Moscow. So he decided to swallow it. Then he developed hepatitis. He became world famous. And then HIV genome was cloned in 1990, and enterically transmitted non-endemic became HIV. Hepatitis B virus, different genotypes. One Burma 2 strains, and US strain and swine strain. We collaborated with CDC, and we have a quarrel with the CDC, and our names were left out from the history of hepatitis E, whatever reported by the Americans. So this is you are talking about genotype 3 and 4. We are having genotype 1 or strain 1. This is the area that you can see. It was declassified from the Calciviridae and regarded as RNA virus Hepaviridae. This is the genome, phylogenetic tree. This was shown to me by Professor Daniel Dumo during his talk on the hepatitis E virus a few years back. Zoonosis, diagnosis, no FDA-approved test in the United States. The vaccine, very effective vaccine is available, but SMICline, as you'd like all the pharma companies, decided to abandon it because it is not, financially profitable for the companies. The vaccine is there. So we have hepatitis outbreaks in Myanmar. One big one in '96 in Mandalay, the old capital city, Yangon, and the Molamine. Several epidemics. This is a Mandalay, where this is the moat, this is a palace. The moat is the main source of drinking water for the city. All the epidemics are caused by the massive fecal contamination of the drinking water. So 20,000 icteric cases. Case fatality rate is around 3.1%, but in the pregnant women, around 18.3%. We have published all these in the American Tropical Journal of Medicine. Because In Myanmar, you see the hygiene, everything, food habit, no wonder we have epidemic outbreaks. How about HIV research? Experimental transmission of non-endemic hepatitis to the locally available macaques were done in the Department of Medical Research, headed by me, in collaboration with the Japanese International Cooperation Agency, like Daniel Dumo said. That irritated the CDC. You working with the Japanese will stop our collaboration, so stopped. Anyway, I spent 4 years in the monkey experiment rooms, very strict. Anything going in cannot go out unless through the, autoclave. We are sacrificing animal, taking all the, we take liver biopsies, monkeys, at that time, the monkeys operations were better than human operations in the Yangon General Hospital. We have all disposable, everything. And unfortunately, we cannot find the viruses. So finally, we take the bile of the monkey and see under the immune electron microscopy. Just imagine, 30 years ago, we have electron microscopy in Myanmar. Now, even very difficult to have a light microscopy. And a very bonanza, the virus-like particles were detected by our team. And we tried to collaborate with the Nihon University, Japan. And we were late by 6 months for the identification of the genome. Otherwise, we would have been very rich. And then, around in 1990, we did anti-HIV IG persistence studies in collaboration with the Walter Reed Army Center, and very low persistence. You see, and the persistence in the urban is higher than the rural villages, indicating that a massive water supply is the main cause of the outbreaks. Socioeconomic also, poor villages, no, only the big cities. The persistence of the antibody in the children, only 7%. Persistence in the adult, only 10% left. So what happened? That is the reason for having recurrent outbreaks in our country. Only when we have a very good water supply system now and have a safe drinking water, the HIV stopped. So in summary, we have large outbreaks, several thousand persons were infected. The whole hospital is packed with all the jaundice patients, mainly fecal-oral transmission, massive fecal contamination of the drinking water. Highest attack rate is age 15 to 40, person-to-person transmission insignificant. We have studied in collaboration with the WHO. Secondary attack rate is very low. No evidence of parenteral or sexual transmission. Mother to newborn, transplantal transmission, not sure, probable. Highest attack rate among the pregnant women, particularly those in the second and third trimester, with a 20% mortality rate. These are our papers. You can see WinKM. We did a lot of, we were very active at that time. Molecular characteristic-based epidemiology. Then we have published in the sequence comparison of the capsule region of the hepatitis E viruses isolated from Myanmar and China. We did complete nucleotide sequence of hepatitis virus. Finally, I would like to show 1,000-year-old pagodas in Bagan, the first kingdom of Myanmar, which was destroyed by the Mongols. Otherwise, we would have been Muslim at this time. Recently, I would like to sadly inform you that at the time of the earthquake in Italy, where the whole town was destroyed, Myanmar was also affected, and you can see all the tops fell off from the pagoda. More than 140 or patients, the pagodas were damaged, and now UNESCO, with the help of the UNESCO, Myanmar government is trying to repair, but it's a very sad story. And with this, I would like to conclude my presentation. Thank you very much.